First, we start off by locating the site. Okay, the site is usually the fatty part of the back of the arm. You can actually give it on the side of the arm as well. As you see, I have illustrated here. You can go on the back of the arm at a 45-degree angle or the side of the arm. And there are several different sites you can actually give a subcutaneous injection. You can go in the abdomen, your back area, but the most common site is the back of the arm.
The fatty adipose part of the arm. And so to measure, I always go one hand lengths down and I just give a little peace sign. And that way we know this area right here is where we're going to go.
Next, we want to cleanse the site. And you always cleanse the site in a circular motion. You start from the center, work your way out. You want to bring the germs outward.
And we're getting our little microbes off the skin.
We're going to squeeze the adipose tissue, which is the back of the arm, and it's just to create mass around the needle to help facilitate it so it doesn't hurt so much.
You're going to insert at a 45-degree angle,
opposed to a 90-degree angle with the intramuscular injection. Because if you go at a 90-degree, you're going to hit muscle. And we don't want to hit muscle. We just want fatty tissue.
And I have the bevel up, and the bevel is up, and we're going to bury this into the tissue. And we want to, the second we go in, we want to anchor.
inject.
So after we've inserted our needle at a 45-degree angle, we're going to aspirate.
Aspirate, make sure there's no blood in the hilt.
Aspiration is pulling back on the plunger of the syringe to ensure that you're not in a blood vessel.
Aspirating, and to make sure we're not into a vein.
So if you actually do see blood in the barrel of the syringe, you want to abort the emission as soon as possible.
And then we inject the medication and we come out.
You want to push your medication. Not too fast, not too slow.
Inject, release, and wipe with the gauze.
Pull the safety immediately and discard into the sharps container, ASAP.
Take our sheath and we're going over the needle and we discard into the sharps container.
And put on the Band-Aid.
After that, we need to assess the patient for any allergic reactions they may have had or signs of syncope, which is fainting. Then after you've done all of these steps, make sure you document accordingly. Document the medication given, the expiration date, and which arm that you've actually given it into. Documentation is key. Remember, if it wasn't documented, it never happened. So now you know how to do a subcutaneous parenteral. You've been great.